A trauma patient arrives in your ICU. No external bleeding. Skin warm. BP 80 over 30. Heart rate of 42. What kind of shock slows the heart? Neurogenic shock. The silent fall of sympathetic tone. Hi friends, welcome to ICU Simplified, where critical care becomes clear. If you are a medical student, resident or critical care enthusiast, you are in the right place. Let's simplify neurogenic shock, step by step. Neurogenic shock is a type of distributive shock caused by the sudden loss of sympathetic tone. It leads to vasodilatation, hypotension, and uniquely, bradycardia. Unlike other shocks, the patient may have warm extremities and a low heart rate. Neurogenic shock usually follows high spinal cord injuries, especially above T6. But it can also result from spinal anesthesia, traumatic brain injury, or certain drugs like barbiturates. The underlying feature: disruption of sympathetic pathway. Pathophysiology. The key mechanism in neurogenic shock is the sudden loss of sympathetic tone. Without sympathetic input, vessels dilate, causing a drop in systemic vascular resistance. The heart slows down due to unopposed vagal activity, leading to bradycardia. This combination causes inadequate tissue perfusion even in the absence of bleeding. Clinical features. Neurogenic shock presents differently from other shocks. Instead of cold, clammy skin, the extremities may feel warm due to vasodilatation. Bradycardia is a hallmark, unlike the tachycardia seen in hypovolemic or septic shock. You may also see hypotension, flaccid paralysis, and signs of spinal cord injury. 39-year-old man is rushed to the ICU after a high-speed motorbike accident. On arrival, his BP is 80 over 50, heart rate of 48, and his limbs feel warm to touch. He is conscious but unable to move his lower limbs. There is no evidence of external bleeding, no is GVP, no chest trauma, and lung ultrasound shows no pneumothorax. The team suspects a spinal cord injury and considers neurogenic shock as a likely cause of his hypotension and bradycardia. Diagnosis. The diagnosis of neurogenic shock is primarily clinical, but ruling out other causes is crucial. A typical case shows hypotension with bradycardia, warm skin, and a history of spinal or head trauma. Begin with basic labs, ECG, and point-of-care ultrasound to exclude hypovolemia, cardiac tamponade, or tension pneumothorax. An urgent MRI or CT of the spine helps confirm cord injury and identify compression or fracture. Always evaluate for coexisting injuries because neurogenic shock often coexists with hemorrhagic or obstructive causes. Management. Start with IV fluids cautiously to maintain perfusion. The mainstay is vasopressors like norepinephrine, which restore vascular tone and mildly increase heart rate. Avoid phenylephrine in bradycardic patients, as it can worsen heart rate through reflex vagal activation. Use atropine or even temporary pacing if bradycardia is severe. Clinical pearls. Neurogenic shock is often missed because warm peripheries and bradycardia don't fit the typical shock picture. Always suspect it in trauma patients with hypotension and low heart rate, especially if spinal injury is known or suspected. Early use of norepinephrine is life-saving. Avoid aggressive fluids unless hemorrhage is also suspected. Prevent secondary cord injury with spine immobilization, normoxia, normotension, and normothermia. Neurogenic shock may coexist with hypovolemic shock. Always evaluate for bleeding. Time for a rapid quiz. Let's test what you have learned. What is a hallmark heart rate finding in neurogenic shock? A. Tachycardia. B. Bradycardia. C. Normal. D. Irregular. Think. Any guesses? Correct answer is B. Bradycardia. Which of the following is the vasopressor of choice in neurogenic shock? A. Epinephrine. B. Phenylephrine. C. Norepinephrine. D. Vasopressin. And the correct answer is C. Norepinephrine. Neurogenic shock most commonly follows injury to which of the spinal regions? A. Lumbar, B. Sacral, C. Cervical, D. Thoracic. Correct answer is, leave in the comments. Let's wrap up what we have learned about neurogenic shock. Definition: a form of distributive shock caused by spinal cord injury leading to loss of sympathetic tone. Key signs: bradycardia, hypotension, and warm extremities. Don't be fooled. Suspect it in trauma patients with spinal injury, especially cervical. Treat early: ABCs, norepinephrine, gaseous fluids, and spinal immobilization. Hope this helped clarify a tricky but high-yield topics. Subscribe to ICU Simplified for more case-based critical care learning. Stay curious, stay sharp. See you in the next class. Till then, bye-bye. Take care. Stay blessed.